Hey guys, I promised you an update as soon as I had more information. And unfortunately, I actually don't have much of an update for you just yet. It is almost noon, I think, on Thursday. And I will give folks just a chance to get on here. Anyway, it's around noon on Thursday. I still do not have the test results yet from my COVID testing that was done yesterday. So I am still awaiting that. I did get confirmation from the doctor's office that the respiratory panel that they ran that covered a whole lot of things was negative, which means that I don't have kennel cough, which is awesome. I also don't have chlamydia, so that was nice. And there was really a host of other things. It was like 3 screenshots worth on my phone. So if you're just joining in, I was just letting folks know that I don't have an update. I promise. When I have an update, I will let you know. So I'm not holding out. I realized that folks were starting to get nervous because they had not heard something. I've been full disclosure here, so there would be no reason, even if I test positive, for me not to share that with you guys. So just keep that in mind, and I promise I will let you know when I know something. So I am just hopeful that they don't ask me to come back for testing because they didn't get enough of what they need to test. I'm just assuming that they've now been overrun with the requests for tests. As I mentioned yesterday, when I was in the clinic, they said every room was full and everybody was wanting the test. And so that is, I'm guessing that it's taken them a little bit longer to get that information. I only received a couple of questions overnight that were different. And so I wanted to go ahead and address those really quickly. Someone somewhere down the line asked if we have any kids in school. We don't. I do not have any human children. Rick does have 2 boys, but they are estranged thanks to their mother. So anyway, he has not been in contact with them. So we don't have any kids out there spreading cooties in the school systems or anything else like that. So that's good to know. Someone else asked about some of Rick's symptoms, since some of the symptoms that you might have heard about include some shortness of breath and chest congestion, or actually just shortness of breath is what you'll see on a lot of the paperwork. And Rick didn't start experiencing shortness of breath until maybe yesterday or the day before. He's gotten himself really worked up about it and is concerned. And so he called his primary care physician this morning, and they wanted him to go on in to the emergency room. So I just dropped him off. That's why I'm sitting in the car. And they are going to just do an evaluation of him and do a check-in. And they just did not want him to, progress to pneumonia or whatever. So they're just keeping a check on it, which is very smart. So I have dropped him off there, and I will just await word when I need to go back and get him. And as far as how I'm feeling, thank you guys for asking. We slept really great last night. He did not sweat the bed. So he slept pretty restfully, and as did I. It's a little hard to get started in the morning, just kind of, feeling pretty fatigued. But once we kind of get up and get moving around, it's a lot easier. I'm feeling close to normal. I was really, really tired this morning when I got up, but that's to be expected. Yes, my nose holes still hurt. I seriously still have throbbing right here from that testing, and so it's still very uncomfortable. And I've been taking Tylenol and all that kind of good stuff, but it's and using an ice pack and everything, but still am not getting quite as much relief as I would like to have a clarity in thinking. So if you guys have questions, if you're somebody who's watching this and you don't know me personally and you have a question, just please make sure you go back over to this original video. It will be public on my Facebook page, so you can ask your questions there. I am inundated with messages, text messages, direct messages on these posts, which is great. Like I said, guys, I'm happy to answer any of these questions that you have, but I cannot manage all of the messages from people that I don't know that are coming in. So if you're sharing this, I appreciate you sharing the video. My original video is over 100 shares now, I think 150, and 5,000 or 6,000 views. So So thanks so much for sharing. And just keep in mind that if if folks are new to this reality show and you haven't heard the whole story, please just go back and watch episode 1 and then the Q&A follow-up from yesterday. Those will be in order on my Facebook page, and I will try to keep those try to keep that space clean so that I won't be sharing dance videos or cat videos or anything like that. So I'll try to keep those top of mind. I'm going to take a quick look and see if anybody has had any questions. Looks like mostly not. Okay, so lots and lots of folks have asked if we need anything. We don't need anything right now, thanks to awesome friends and family and neighbors. We have gotten our immediate needs met. So Kara and probably Daniel, I'm not sure if Daniel was with her last night, dropped off a ton of soup. Amazon Prime Now dropped off some stuff to us this morning that we were able to order yesterday. The demand on their systems are pretty heavy right now. So, just expect if you're placing an order, because you're trying to stay out of the stores and things like that, that it might take a little bit longer for you to get some of your orders in. Somebody has delivered something here now. I'm not sure what it is. I'm excited to find out when I get out of the car. And then someone else today, thank you, Mary. Somebody's dropping off a nice bundle of TP later. So we'll be all good to go. We've got baby wipes. We've got hand sanitizer. We've got soap. We've got all the things that we need right now. But I do promise to let you know if we need anything else. Thanks to Kyle for going and picking up my medication today and getting all of the marching orders from the pharmacist there at Walgreens and Donaldson. She's awesome, and just really appreciate them working with us to let strangers pick up our medication and things like that. So everybody's been really great and supportive. And if I learn anything else, I promise I will come on as quick as I can and give you that information. And if we get any news about Rick after they're doing this testing, then I will let you know. One of the things that he just texted me about earlier is that they had us pull into the ambulance bay at the hospital, and they came out to get him. So they are taking precautions with folks who are exposed, or obviously he's tested positive. So they came and got him, and they have set up I'm calling it a tent. I don't know if there's actually a tent there or not, but they have something away from the regular emergency room where they are set up and ready to receive patients and do some of their evaluation. So I'll get the full scoop on that later, but I'm assuming that's just part of their protocol. For those of you who are in the medical field, they often set up alternative places to be able to do the exams and things like that. And that is just something that they do to help with the capacity. And also I'm assuming to keep all the cooties separate that they can. So I have really not had any super snarky comments or rude comments. A couple of things that I saw that just kind of were like, really? Was only because I went looking for them on all these shares. I was trying to just track and see if people had questions. And they were just self-interested worry. It really isn't anything. Nobody's being asshole-ish, truly. Several of the folks that I have come in contact with are just really nervous. And I understand that. But again, I'm not withholding any information. And I cannot have an individual conversation at this point with every single person who I might have come in contact with in the last 2 weeks or so. And I appreciate you guys for understanding that. I'm doing the best that I can to keep up with our friends and family and my work and all of the things that we're trying to do. So speaking of work, I have a couple of deadlines that I absolutely have to get to work on today. We've been trying to get some things off of my desk, and of course yesterday just kind of disappeared to all of the things that we had to deal with in terms of talking to providers and me going to get tested and all that kind of stuff. So anyway, keep the questions coming. If you have them, I'm happy to answer them. And again, if you're someone who does not know me personally, just make sure you go back to the original video and place your questions there to make sure that they get seen. And again, I appreciate everybody so much for all of your kind thoughts and prayers and hearts and all the other emojis that everybody's been sending along. And so I will just keep you posted as soon as we know more. Okay. Hope you guys are having a great day. Stay safe. Wash your hands. Don't spread your cooties. And I will talk to you guys later. Okay. Oops, somebody has a question. We don't have the test results yet. They have not given me any information about the test results. So I just said there's a ton of stuff that I tested negative for respiratory wise. Literally, there was, I don't know, 20 or something things there, but they're still awaiting the results on the COVID-19 testing. I don't know why. I did not speak to the doctor. They actually just sent me my test results in the Vanderbilt app, My Health at Vanderbilt, which is awesome, and that's how I communicate with all of my my doctor's offices. And so through the app, they sent me the test results, and the doctor wrote a note just saying that everything was all clear, but we were still waiting on the test results for the COVID-19. And I just mentioned earlier, I hope that it's not because they need more material from my face, because I don't think I can handle it again so soon. So I promise to let you guys know as soon as I get those results back, or if they let me know that they're inconclusive or whatever they let me know, I promise that I will let you guys know just as soon as I find out. So thanks again so much. And I hope you guys are having a great day. All right. Talk to you soon.